Hello, everyone. Happy Tuesday. Welcome to Dentists and Pediatric Sleep Disorders. Your questions answered. Your questions answered. Want to thank you all for being here. We have a stellar panel, and they're like gremlins that ate after midnight where they're multiplying. We've got a third panelist, Dr. Michelle Weddle. So we'll introduce her in a moment. But real quick, I want to say thank you all for being here. Your commitment to your patients, your practices, the furtherance of your education of this profession is truly admirable. So thank you. And let me take a moment to introduce our esteemed panelists. Our first panelist is Dr. Stacy Becker.
Hey.
Dr. Becker is one of my dental sleep besties. She's my pickling bestie. She can tell you what that means some other time. But I've been fortunate to know Dr. Becker since really, her genesis in dental sleep, and to see her commitment to the field grow and to watch her further her career and help so many people, and initially patients, but now scaling that by helping more dentists help more patients has really been a phenomenal experience in my life. So I can go on and on about you, but I'll let you do it a little bit, Dr. Stacy.
Oh my
Who are
gosh.
you?
You know what? It's funny, touche, because I feel the same way about you and watching your growth in this field. And we were both you were definitely more into this with sleep than I was when I got started. And I would call you like crying, what device do I use? What course do I take? So I appreciate you too, friend. So, and I'll keep it brief. Those of you that don't know me, I started in adult sleep and needed answers for my kids. So, and there weren't any from the medical community. So, started diving in and taking tons of courses on expansion and myofunctional things. And then I met my two sisters from another mister just in all these courses and all this talking. And we developed ASAP pathway because there was nothing like it. And so that's where we all came together.
Love it. Well, let's introduce another one of those sisters from another mister. Let's go with Dr. Tracy, aka Dr. Tracy Wynn, aka Pookie.
Pookie.
Dr. Wynn,
It's
give
forever
us a
now.
little.
I'm forever known as Pookie. I don't even know where that came from. I didn't know we had these beautiful nicknames, Stacey. But yeah, no, I mean, to the core, I'm a restorative doc. I mean, so my background is very different from Stacey and Michelle. Hardcore restorative, American Academy of Cosmetics, and COIS trained. I'm more of like a big research person and evidence-based. And so when I got into this, I dived into the evidence behind it and the research. And then I pretty much picked up social media and to put a platform around it. And that's how actually I met Stacy. She messaged me from one of my posts about my screening tools. So I think that was fun. Met Michelle because I wanted to learn all these things, and I couldn't afford to pay for everybody to do it. So I hosted courses. So I figured, I told these speakers, I'm a pretty good marketer. I'm going to bring people to you. And that's what I started doing. I started posting a lot of courses. And then that's how I met Michelle. She came to my courses. And then we just realized that whole year we had a bunch of courses together. But yeah, I mean, the reason why we were together is because we still needed answers. After every weekend course, we were still hungry for answers, and we leaned on each other for that.
Yeah, and well, thank you. Thanks for being here. And Dr. Michelle Weddle, we tried to get you the third musketeer. You weren't promoted as a participant because you said, I never show up for a webinar unless there are at least 200 people registered. So when we hit that mark, you agreed to join last minute. So thank you, Dr. Michelle Weddle.
This is how rumors start. You see that, Jason? But thank you for having me. I was so bummed when I thought I couldn't make this, and then my schedule changed, and voila, I was able to join. So just like my sisters from another mister have said, I am pretty much usually the in-between between Tracy and Stacy. So I started in restorative and then I went into adult sleep. And so I have a little bit of the elements of Tracy's practice and Stacy's practice, but my practice is mainly a family practice and multi-generational practices. Multi-generational patients. And so I've seen a lot of the patterns that follow mom and dads, grandparents, aunts and uncles. And in helping one generation, you can help to understand the next generation, how to better care for them. So I can't think of anything better, more impactful to a family's life than managing and helping the kids, because mom and dad, their schedule run around the kids. And if a child is having difficulties, it's just very disruptive to the household. So the changes and the benefits are amazing. So
And that's just what we're going to talk about tonight. So before we dive into the first question, though, real quick housekeeping. There is at the foot of your screen, you can type in your questions. There's a chat box as well. So type in your questions as we go, and we'll try to get to all of them tonight. Also, you will receive your CE certificate via email in the next 36 hours. So don't email me in 10 minutes after this webinar concludes and say, how do I get my CE certificate? You will get it via email in the next 36 hours. If you don't have it by the time you go to bed, or by the time you go to bed on Thursday, then shoot me a message. We've got a problem. We'll get it resolved. But keep an eye out for your email. That's me. I wrote a book called Transform Dental Sleep, and let's dive in. So our first question, and these questions, they were submitted by registrants like yourself. And what we did basically, because we had a couple hundred people registered for the webinar, we took the most common questions, kind of the themes, and curated them into sort of an overarching question or questions. So these are the questions that you had. The first is, at what age should we start looking for signs of sleep disorder breathing? And how do we know when we should treat versus when we should refer out to a specialist? Stacy, you want to kick that off?
Yeah. And this is just a really loaded question, because I mean, especially part two, but bottom line is at birth. Sleep disorder breathing can start as young as birth. Mouth breathing in a newborn is a massive problem. And we know, based on the research, even just snoring, not necessarily frank end-stage obstructive sleep apnea, can lead to neurocognitive deficits, behavioral changes, just under the age of 6 if we don't get to it. It's a very basic, simple thing we as dentists can be looking for in our offices or in our families or in our neighborhoods, is a child not breathing well through their nose. So sleep-related breathing disorders can start at birth right away.
Okay. And Michelle, I mean, what signs and symptoms should people be looking for? Should dentists be looking for from birth?
Well, one of the biggest things is mouth breathing and struggling, audible breathing, right? So breathing through the mouth. And also when the child is asleep, you can hear it. A lot of people say snoring, but a lot of kids don't necessarily snore per se. It's mainly that heavy labored breathing that that they're having difficulties already. And so this is one of those things. When should we refer out to ENTs? We know that when a child can't breathe through their nose and they're changing their breathing mode to mouth breathing, they're just not growing the way they normally will grow. They don't grow into their normal trajectory. So as early as we can address that, that would be one of my most important signs to look for.
What about Tracy? There were a lot of questions surrounding bruxism in kids. I
You
mean,
know,
what are we looking for there? When is it, when should you be concerned?
So there are several hypotheses or reasons for bruxism. So I do think that do think there's studies that look at nasal obstruction, tonsillar obstruction, and its relation to bruxism. There's studies that look at non-anatomical factors like iron deficiencies to bruxism. So, I mean, bruxism is sleep bruxism is its own sleep disorder in itself. And I think a lot of people tend to think it's always obstructive, and it's not always obstructive. There's studies in children and adults where we look at it, that it relates to more of like the sleep disorder breathing versus obstructive sleep apnea. So bruxism is one of those that there's a lot of arguments for. And I think there's a reason there's many reasons for bruxism. So I think that's one of those. But if you see it, you definitely should dive a little bit more. I think if you see bruxism, it's pathologic, period. Now, what is the pathology is another question, but it is pathologic. And I think that's one thing everybody can agree on, that sleep bruxism is pathologic.
Got it. So when you identify one of these patients that's whether it's the audible breathing that you described or bruxism, how do you know if it's something that you should potentially be treating in your office, or you should refer out to an ENT or another specialist?
Well, I think when you refer to an ENT, you have to ask yourself, like, what are you looking for? I think that's how we should be thinking when we refer to any specialist, whether you're referring to your dentistry and your ENT is the same. You have to think about what's in their wheelhouse. What are you asking them to look for? Like if you're looking at mouth breathing and bruxism, then if you're questioning if you should refer to an ENT, you're asking yourself, is there an obstruction that an ENT can address? And so which means that, is there something that you can't see, would be adenoids? Is there something that's outside of your window, the allergies and other respiratory diseases? And those are things you're trying to rule out from an ENT. I mean, it's funny because I have people that goes, an ENT called me and goes, Tracy, I'm getting a lot of people refer to me for mouth breathing. What is this? Or dentists refer to me for large tonsils. What is this? And I think the thing is, when we speak to our ENTs, and I think we do this really well at ASAP, is like, what are you asking the ENT to look for? What are you asking the ENT to do? It's just, so I think that if you suspect that the child is suffering from sleep disorder breathing, it's important to understand what their guidelines are. And key things to look for is not tonsil size. Key things to look for is really, when it comes to children, is the neurocognitive consequences. They understand that. They understand if a child is video recorded and they can't breathe at night. They understand the labored breathing, failure to thrive. Other risks like obesity, the neurocognitive ADHD. Like when you start saying, my child is starting to be a different child, he can't control his emotions, things like that. I think most ENTs and sleep physicians are like, okay, there's signs of neurocognitive issues here.
100%.
So when you do encounter those issues, how do you have that conversation with a parent, especially one that provides some pushback? It's like, no, my kid's snoring, it's normal. You cretin. Like,
Yeah.
that's what kids do. I mean,
So I don't
how do
tell
you
parents
have that conversation?
So I don't tell parents there's something wrong with their child. I think that I think for any parent, a parent has to be ready to hear it. So I think it's important, like if you're going to do this Monday morning, just start with a questionnaire and let the parents ask you. I think what I've seen where parents get very upset is like when they're not ready to hear that something's wrong with little Johnny. And then they start to think that, oh, you're just trying to make money off of me because I heard this is a scam. Like what I do in the office is we do these questionnaires, especially with kids. We give them every 6 months. And when the parent is ready for it, let the parent look at their child. And when they're ready for it, they'll ask you for it. But when you start before the parent is concerned, I find that if the parent's not ready for it, they push back and then it can become negative. That's been
I-
my experience. I mean,
I was
Stacy,
going to
Michelle.
piggyback off that. I agree. Because let me just tell you how I went in guns ablazing about 10 years ago, man. I was telling every freaking parent, like, oh my gosh, their face, they have mid-face deficiency. They have this, they have that. You know, you do have to, these are their kids. You can't talk to them the same way you talk to Bob, you know, the truck driver that is choking on his tongue every night. You got to go in and kind of, you know, Mama Bear is staying in the operatory. She came in to talk about teeth, and now you're talking about her kid. So you about something she wasn't prepared for. So like Tracy said, I use the ADA's brochures that discuss pediatric sleep, which is really good because it gives the ADA seal of approval. It means something. Whatever side of the fence you land on with the ADA, it means something to the average patient. So if you hand them a form, a little brochure that talks about the dentist's role in screening for kids for airway issues in the dental practice, they're like, oh, this isn't so crazy. And like Tracy said, we use an ASAP. We use the validated pediatric sleep questionnaire. It's the only validated PSQ that's out there. There's a lot of sleep questionnaires, but the Shervin PSQ is validated. And start asking questions, just plant seeds. Some of the parents are like, oh my gosh, you're amazing. Thank you for bringing this up. I knew there was something the pediatrician wasn't telling me. I couldn't get answers. You're my savior. And then other parents look at you while over their cell phone, like, are you done yet? Does he have cavities? Because I gotta go. So, you know, you just are gonna have to plant seeds. Sometimes it takes 2 or 3 periodic exams before they say, you know what, I took that questionnaire home and I have started using Snore Lab and recording my kid. And I think there's something going on. All right, let's talk about what we do next.
So let's talk about what you do next, Michelle. This question came through in a bunch of different verbiage, but the question was basically, you know, what treatment modalities can dentists provide?
We have a lot.
What?
We have a
There's
lot.
you have a lot.
Let's hear them.
So I really think this is the most exciting time to be a dentist. I think the next 5 years are going to be really insane with the collaboration between medicine and dentistry. For adult sleep, that's been a slow, creaky road, but hopefully that's coming. But for kids, man, I think we've got a lot of opportunity to sit at the table just because of the aspect of the orthodontic interventions that we're being asked to do because we're seeing it helps. But as young as just like what Tracy was saying, like audible breathing, you know, mouth breathing. Sometimes it's just the dentist even guiding a parent to nasal hygiene, you know, and helping a parent with that, or getting them to an ENT, getting them to the myofunctional therapist. I really believe what Steve Carstensen has coined the general dentist as the primary care of the airway. We're that important in all of this. I mean, you know, but we need a team, but we're the ones quarterbacking this. And it's really important for dentists to get their head out of the sand, do what the ADA has recommended, at least understand how to screen, identify, and refer appropriately. Who are you going to have on your team in town for these kids, these adults? Because now you know better, so you have to do better. We have to do better for these patients. We're the only healthcare providers that can do this. And if you're an orthodontist, a general dentist, a pediatric dentist, we even have periodontists and ASAP that are doing orthodontic intervention, and general dentists. I think I already said dentist, but
and we have a very, very valuable member of our team, our hygienists, who are built-in educators in our practice, right? So a lot of the times our hygienists are taking the lead when it comes to lifestyle and diet and nutrition. We know, and parents can come to expect already, that we're giving pointers how to avoid cavities, things like that, right? But it can go a step further. How can we, like Stacy was saying, nasal hygiene? How can we clean the nose? What do we do to the bedroom? Do we dust the blinds? Do we change the bed sheets? Just little things like that that parents can do to help facilitate nasal breathing and get some good habits, some good sleep hygiene habits, some good nasal hygiene habits. It comes a long way, especially when a child is starting earlier, starting younger. And we know that as a dental team, we see our patients usually more often than our physician colleagues. So I think it's very impactful, those little touch points that we have with the dentist, with the hygienist, with the specialists. We have such a tremendous opportunity in dentistry to be able to do that.
And it's really
And
staying on top of
Michelle,
the literature too. Oh, go ahead.
no, keep going, Stacy.
Well,
Staying on top of the literature.
it's just staying on top of literature. I mean, man, it is exploding. And I thank God there's 3 of us. And really, when we look at our members, we're like, there's hundreds of us because we all learn from each other. But what's coming out, the amount of allergies that are occurring in kids, the research coming out. I mean, one of the number one reasons for nasal obstruction is chronic allergic rhinitis. You need your allergist. You need your ENT. I can expand you all day long, which is needed, but I need that allergist to help me keep that nose open. But the literature coming out, gut health, what is going to emerge with gut health and sleep apnea in the next few years is insane. You can look at the gut bacteria and you can actually cause desaturations and apnea when you change gut bacteria. You can actually improve desaturations and apnea when you change gut bacteria.
So I'm
huge.
just real quick, Stacy, give me a sec there. So I'm thinking about just, dentists that you and I have met over the years. Everything that you just shared, critically important. But you and I both know there's a population of dentists that say, man, I'm just here to fix some teeth. I don't know why they all sound like they practice in your backyard, but
I don't
you know what
know
I'm talking about.
But yeah. Well, I'm just a tooth mechanic.
Yeah, I'm just a tooth mechanic, and now you're talking to them about, microbiomes and gut health. What do you say to that dentist?
Well, the same thing when, let's get real, dentists didn't wear gloves and then AIDS came along. Gosh darn it, I got to put these freaking gloves on. Oh, wait, we have to do oral cancer screening. Gosh darn it, I got to do oral cancer screenings. Welcome to the new age, people. I mean, get on board. This is just, we know too much. And if you want to stick your head in the sand, I guess that's up to you. I can't maybe make somebody want to do better. But if you know that you have just kind of this ethical, hey, you got a person in your chair and you're seeing all these signs in their mouth, faulted palate, red gums, chapped lips, venous pulling, like, you better pull back and say, you know what? Or you got a cone beam or a a cone beam or a ceph, and you can see big adenoids. I mean, at least refer to the ENT. I mean, it's just like oral cancer screening, just like there's dentists that probably don't take blood pressure, but we're supposed to. So, I hope they would get on board, but I also think a lot of those dentists are probably dying off, to be honest. I think that coming out of school, they know a lot more than they used to. I think this is slowly being integrated into the schools. I know the orthodontic programs are starting to incorporate sleep. I know Audrey Yoon's orthodontic program, when they come out of ortho, they know sleep. Audrey Yoon has sleep medicine and dental sleep medicine as part of her orthodontic residency. So times are changing.
Yeah. They are changing, but some things stay the same. One of those things is, so bear with me here. I've hosted over the years, I mean, literally hundreds of sleep webinars. And the one topic that dentists get most excited about are the 2 topics. One of them is insurance, how do I get compensated for treatment? And the other is talking about acrylic, talking about, tactile things that they can put their hands on. It's like, you want to talk to them about anyway. So there are a lot of questions about the different appliance companies. And I know that this can be a touchy subject because, we all have, friends that work for different companies. Having said that, we purposely don't accept sponsors for our webinars. So we're beholden to no one and we can speak freely. This is, some version of this question came through from many, many people. Which appliance is best? What about Healthy Start? What about this? What about that? So can you speak as openly as you're comfortable with about maybe the top 3 appliances that you do use and, sort of why? We don't need to nix anybody, naysay anybody, but yeah.
Before one of us answers that question, I'm going to preface that by piggybacking on what you said about, not having sponsorship. One of the, I think, best things about ASAP Pathway is we are independent and we are appliance neutral. And we don't appliance shame and we don't appliance favor. But what we do is we really try to hone in on, well, what's your diagnosis? And what is the goal of your treatment? Because what we were talking about earlier, depending on the age of the child and depending on what that child presents to you with, what is the biggest problem? You can have a 6-year-old that their biggest problem is crowding, and you can have a 6-year-old, their biggest issue is ADHD, presenting with crowding, mouth breathing, all of these other things. So what we would do, or what the priority of our treatment goals are for each individual, would be different. And that will inform the choices of treatment options that we would provide. So I just wanted to preface that.
I thought that was great.
And
that
that
was
answer,
great.
because, I just feel like we are dentists and we want to get our hands on things. Right? We just want to get our hands on things and we want to do things. And I think that as dentists, we are very proactive and we want to fix and intervene and make things better. And we are so fortunate in dentistry that as dentists, we can almost get immediate gratification, right? We have a tooth with a hole, we put a filling, they're fine, right? We have a patient with pain, we send to endo and voila, no more pain. So we are so fortunate in our daily lives and in our jobs that we just we see a problem, we want to do right away.
Sure.
But the issue with sleep is it's multifactorial. So it's not just the dentists want, I'll be in the bathroom and I'll have people come up to me at a course and go, okay, what appliance do you use? I'm like, are you serious? Like, it is not just one appliance. It is, and I used to be that way. What do you use to expand? I don't know. It depends what the diagnosis is. It depends. Am I wanting more transverse? Do I want a little more sagittal? Are we dealing with more function right now? So I think, what's their age? What's their stage of growth and development? That's going to totally decide. Am I going to use Invisalign first? Or am I going to need to get in there with a little bit more mechanical oomph because growth and development has slowed down? What kind of skeletal movement can I get? Which is why we don't, we have ASAP members that have taken MyoBrace, Great Lakes ortho courses, Healthy Start courses, TAD expansion courses, MARPE classes, ALF classes, BioBlock class. I have taken all those, and we have, there's a place for all of it. There really is. And you also have to look at what works in your hands. What age group are you wanting to work with? What works in my office for me and my team might be one system. The bottom line is, what is the diagnosis? You're going to get in and out. What are you going to accomplish with this parent, with this family? We need an end goal in mind, and how are we going to do it? Okay, now let's pick. What appliance. Because if you're looking for expansion, well, how old are they? All right. You have A, B, and C. Pick what works best for you.
Tracy, what would you add to that?
She's laughing.
I think the thing is a lot of and I'm so glad you don't have sponsors, and we're the same way. Like we're not bought by any company either. But I think that You know, when you're treating kids, you're really dealing with growth and development. You can't say that this appliance fits all. You know, like that's just impossible. And I
Mhm.
think like we we have to really start teaching people like what's the diagnosis, what's your decision tree, and what are you really treating? Because if you really know what you're treating, then it really doesn't matter what you use. That's the key, and I think that's the problem is, like, I think everyone thinks and they're sold that there's a magic appliance. This is the magic appliance. Every child should wear this to treat mouth breathing. Well, you don't even
Yeah.
know what mouth breathing is. You don't even know what's causing it. Is it really like so I think we've gone I I think from a treatment planning side, our industry has went too fast and it's driven by money, and we have to kind of slow down because when our treatment plan is that fast, we have to slow down because that's where all the negative that's that's why we are not progressing as a profession because like we're going too quick at it. I mean, we have to kind of slow down and really rely on our specialists, understand growth and development. I mean, it's going to take a while for us to really figure this out, and it's not all about anatomy. Um,
100%.
but you really do have to understand growth and development. Like I think when we first started this, and I'll be the first to say I took all of those courses. I took a lot of those company-based programs because I was sold into appliance first thinking. I think we have to get away from appliance first and saying, what does the patient look like? That
Mhm.
mindset of, okay, this patient walked in my door and they have a sleep study, appliance first. Well, we see it on social media, right? We see like, hey guys, this 70-year-old patient came to my office and this is his teeth. And we're like, well, what does he even look like? Because that teeth can fit any
Sure.
face, right? You
Yeah.
could take that
Yeah.
same amount of teeth and put it on all four of our faces, and we would have the different treatment. And I think that's what we're kind of missing here with like, we're so appliance driven, treatment first driven, and we shouldn't really be that way.
I also think
So,
like,
I mean, what what
oh,
what what I'm kind of hearing there though is, and it can be challenging. You're talking about a mindset shift,
Yeah,
and especially in a culture in which we're very everything is Amazon Prime. It gets to your house before you even think about it.
yeah,
Um, you're telling everyone to slow down and take a more comprehensive view of the patient that's in your chair.
yeah.
And
I
that's
mean,
probably a tough sell to some dentists.
Jason, the moment that we become what is the best appliance, you might as well just tell the patient to go buy that appliance at Amazon. Like
Mm,
the moment we say, you, which appliance should I use? You'll just jump into it and buy it at Amazon. I mean, the reality is like when we teach it, we say that, okay, especially with children, it's like, okay, children 6 to 10, this is what 6 to 10 is this. Okay, now 6 to 10, break down 6 to 10, you're class 2, class 3, you're class 1s. Okay, then you break that down. Now there are different variations of class 3. So now let's break that down. And then, okay, so then you got to the 10. So now let's talk about your 10 to 15s. What are you doing? Your class 1, class 2, class 3. At your 15-year-olds, what are you doing? Class 1, class 2, class 3. There's no appliance right out in the market that can hit every single child at every single age group, at every single classification. And if any company sells you that, that's wrong. I'll
well,
be the
here's
first to say that because it
we
doesn't make sense.
no, we've gotten again why we formed ASAP. How many times, guys, have we sat around on a Sunday, try appliance A, we tried appliance B, we tried appliance C, and we were over promised a result because it wasn't really. Again, there's a
Yeah,
place for some of these appliances. There really is. I
yeah,
love them all for different reasons, but it's what's your diagnosis? And here's the other thing. A lot of dentists have come back from these weekend courses. They throw a device in, they think it's going to cure everything, and then they're really bummed out when it hasn't. And then the dentist
mhm,
is kind of over promise something to a patient. That is a bad position to be in as a doctor. And they don't really have support. They have reps. They're not doctors helping
yeah,
them. You call the company
mhm.
and they're like, "Well, let me ask Bob. Let me see if Bob's on at a course this weekend and Bob can help you." I'm like, "Bob shouldn't be directing your care. You need help from other doctors directing this
yeah.
care."
Yeah.
And you
Well,
throw in
that is a
appliance
great.
during,
Okay.
yeah. Well, you throw an appliance during growth and development, and you can potentially make it worse, like if you're not going in the right trajectory. But as a teaser, Jason, we're going over this in Arizona.
I was just
Like
gonna say.
we will definitely
What-
go over appliance selection based on growth and development
Yeah.
and based on signs and symptoms. We're
In
definitely doing
fairness,
that.
yeah,
'Cause
we
you can't
really
Well,
answer-
that's a stellar segue. I'm going to take that baton from you and run with it. So before we get there, though, I want to take a sec and talk about give you all an opportunity to talk about some of your upcoming courses, because I did say that we don't have sponsors, and that's legit. You haven't paid anything to be here or anything like that. I asked you to be here because this is a topic that we receive so many inquiries about: pediatric sleep disorder breathing. And you all are, what you've put together with ASAP Pathway is such a treasure trove of information, but not just the information. You've also provided an incredible community of dentists that can learn together and grow together. So you do have a couple of upcoming events. You want to just kind of give a quick overview about when those are and what attendees will learn and how they'll be different afterward?
I guess
Can I
Get there
just
on that.
say, they can go into the course details. They're amazing and they work super hard. I will have to say, Michelle and Tracy are like heavy lifters with these courses. I'm so appreciative. But what's interesting about our teaching, and how when we incorporate other instructors is these are orthodontists. These are very comprehensive, airway minded, orthodontists that are teaching these courses, and they're teaching other orthos, and they're teaching general dentists at the level of orthodontists. And I think it's important when you're doing this that you're doing it in a way that it is at the standard of care that is done by an orthodontist, and that you stay in your lane and you know how to help, but also we want to keep your head above water and we don't want you to get in trouble. But go ahead, guys, give the deets on the courses if you want.
What are the deets? What are the deets, Pookie?
Come on, Pookie.
I'll let Michelle do that. I just
Okay,
went,
Michelle.
yeah.
Michelle's your turn.
Pookie. So the deeds on these courses, ASAP courses, really, I think they're known. Our biggest goal is implementation. We like to learn the material. We have online material also, but our live courses, which these two are, they're really meant for implementation. And so there's part 1 and part 2, and in between, we have huge support, a huge support network. Elia, Courtney, they do a really good job moderating and supporting their own personal, it's a private WhatsApp group for the class. In addition to that, we have the WhatsApp group for ASAP members, where all ASAP members can now chime in and give perspective, give us some experience, stories about their experience with one expander or appliance versus another. And it's a very frank conversation. It's a doctor to doctor, dentist to dentist, and you run the gamut. We run the gamut with our membership. So we have beginners, we have middle, and we have such advanced practitioners that you'll really get a very well-rounded perspective. And like what Stacy said, we've taken a lot of these courses. And if you incorporate all of our ASAP members, I don't think there is a course in pediatric airway or sleep or TMJ that has not been taken by any one of us. I think we have covered all of the courses that's available. I'm pretty confident to say that with our membership and the 3 of us, we have taken it all. So when we have a course like this that's live, our biggest directive, our biggest drive is implementation. And so the support is there.
Yeah, well, and that's one thing, and I say this with total seriousness. I try to avoid speaking in absolutes, but I have absolutely never spoken to anyone that had anything negatively critical to say about ASAP Pathway or Spencer Study Club. Those are 2 groups that I would say I just hear raving reviews from members of both. And it sounds like, because with pediatric sleep, it hasn't grown, it hasn't scaled to the size it one day will, right? I mean, you mentioned, kind of this growth trajectory that's coming, Stacy, but it hasn't gotten there yet. So most dentists that get into this are probably going to find, they've got their friends in their study club that they can go to about any sort of restorative dental issues. But when it comes to pediatric sleep, they probably don't know many people in their circle that are well versed. And you bring this community, this tribe that you've created. So everywhere they turn, they've got knowledge, experience, and support to help them along. And it's really what you've built is truly admirable. And I would say to every dentist that's on here right now that has an interest in this, and you do, or else you wouldn't be here. But if you want to take the next step, I'd really suggest you become an ASAP Pathway member. There, I said it. There's your stamp of approval. And then Tracy, you mentioned Arizona and some deep dive discussion on devices. How's that for alliteration? Deep dive discussion devices. January 31st and February 1st, we're having the second Transform Dental Sleep Symposium in beautiful Scottsdale, Arizona. As it says there on your screen, those are just a few of our speakers. We'll have another, that'll double in size by the time the event rolls around. But for any of you that were there last year, maybe a third of the speaker roster consisted of physicians. So it wasn't all just dentists. We're going to add some more physicians this time around too, although we do have one already. Pediatric sleep disorder breathing and TMJ disorders. Those were the number 1 and number 2 topics that attendees last year said they wanted to learn more about. So we invited the ASAP team to be presenters. We're thrilled that they'll be on a panel discussion at the meeting. But then also the day before the meeting kicks off. So we're talking about Thursday, January 30th. From noon to 6, we're hosting a special workshop with Dr. Tracy, Dr. Stacy, and Dr. Michelle that will be a deep dive on the topic that we're covering today. So it is so much, to cover in 45 minutes or whatever we have tonight. So this will be a relatively deep dive on that topic. It'll allow them to expound a lot more on what we've discussed today. And it is a small group session. While there will be several hundred people at the symposium, this workshop is limited to just 35 participants. So if you want to register, and I encourage you to do so, go to tdssymposium.com, register for the symposium, and then you can add on your registration for this workshop. You will learn a ton. I think everyone here would agree, based on what they've shared already today. We would never overpromise and say that you're going to walk away and be the expert, but you will learn a ton, and you will have a clear pathway on where to go next. So go to tdssymposium.com, get signed up. Anything else y'all want to say about that before we dive back into some questions?
No, I think
it's gonna be fun.
Yeah.
Yeah, it's going to be a blast. It will. It was last year, and
It was nuts.
Yeah, it was nuts, huh?
It was nuts. I was so proud. I mean, again, I've known you for so long. I'm looking around and I'm like, this is the first year of TDS. And I'm like, this is amazing. It was packed. I mean, the vendors, I know that it's already got to be bigger because
I know that Stacy came back from that seminar, from that symposium, and she's just like, oh my gosh, and she was so excited, and I'm like, dang it, I missed it again. And I'm like, I am going to be there next year.
Yeah.
So happy to be there.
It's great.
Yeah.
It is really great.
I'm thrilled y'all are going to be there. I feel really I know that there's so many demands on your time with ASAP and then with your individual practices. So the fact that you're willing to come out and share your knowledge and your experience with everyone, it's really a boon for them. And I'm personally, I'm just kind of humbled, that y'all would do this. So thank you.
But what we love about what you put together, the format of this workshop, it's a 12 to 6, right? And people can take a real deep dive so that when they go back to their practices, they can really apply.
Yes. That's,
good amount of time.
Michelle. Yeah, and to that point, for anyone that wasn't there last year, the focus of the TDS symposium is action. This isn't, it's not high level academia. It is actionable, practical content. It's taught by people that have been where you are, that have been where you are and are currently now where you want to be. So you'll learn from the best. Everybody's fun and energetic. It's going to be a blast. Get registered. I don't want to toot our own horns too much. They'll have to get signed up and find out for themselves. Earlier, I think, Michelle, you mentioned myo. Can you talk a little bit about what role myofunctional therapy plays in your practice and, how if I'm a dentist and I want to make this a part of what we're doing, how do I get started there?
Well, myo is so close to my heart, so I love that you picked me for this one. But we always joke that myo and preformed appliances, it's the gateway drug to pediatric airway and sleep. So the benefit of a lot of myo education and all the prefab appliance education is that it has increased awareness for dentists to be able to look for this and know that this is our lane. So what role does myofunctional therapy play? So we know that there's structure and function, and myofunctional therapy, will address that function. Just because we changed something, we expanded, we unblocked the nose, we released the tongue tie, right? Just because we changed the anatomy doesn't mean that the child will automatically change their function. And so I always tell my patients, when you go to get, a bone or a joint, so get your knee fixed, for example, get your ankle fixed, that, after surgery, after changing the structure, you're going to go through physical therapy. So it's a very, very similar thing. When we're doing something like this, we're changing the craniofacial structure, the function comes hand in hand, and the function will enhance the structure, and the structure will facilitate a better function. And so myofunctional therapy plays a hugely important role in my practice. And just like any other branch of dentistry, endodontics, orthodontics, periodontics, anything like that, oral surgery, right? Just like any branch of dentistry in a general practice, because that's what I have, I pick and choose. There are some root canals that I'm comfortable doing. There are some root canals that I'm going to refer out. There are some teeth that I'm comfortable extracting, and there are some that I'm going to refer out. So it's the same thing for myofunctional therapy. Again, what is the diagnosis? What do we see? What is the child starting out with, and where do we want to go? And do we as a practice have the means and the availability and the staffing to be able to do that? Or is that something that is that child better suited or better served with a referral to an SLP or a myofunctional therapist?
And some people can. I mean, we have members that incorporate it, into their practices and have their hygienist go through training. And we have modules within ASAP. And we have some faculty that are SLP myofunctional therapists. And it's really exciting what can happen with function when you change the function, and especially in little kids, and that's where all this starts, is poor breathing, poor function, and it leads to all these malocclusions and it leads to all these structural changes. So the impact you can make in a 2, 3, 4, 5-year-old, and that's the demographic nobody's really touching. The orthodontist will see a 6 and 7-year-old, but the 4, 5, 6-year-old, who's going to see them? And that's just a great window where you can make some amazing changes with function and some other, intervention strategies that can really change their trajectory. There's a definite role for myofunctional therapy. It's just, do you want it in your office or do you want to have a team outside your office? But there's a place for it for sure.
Got it. And then, earlier I mentioned the default to discussions about appliances. There were two things. One of them was appliances and the other was reimbursement, compensation, the financials, right? So one question that came through is, or came through in a bunch of different ways was, how do I bill for this? How do I get paid for this? Does insurance cover it? What does that look like?
Does somebody want to take myofunctional therapy isn't covered by dental insurance. And most of what we're doing interceptively with orthodontics is dental will pay for some of that. Now, I know that they're working on medical. What are you seeing with medical in your office, Michelle, with some of the orthopedics?
So I'm really not billing a lot of pediatrics right now in terms of insurance. So I know that in terms of myofunctional therapy, if we do it in our office, it's not covered by insurance. But I do work with some, there are some physical therapists, there are some SLPs that are working in my area, some myofunctional therapists, COMs that are in a situation where they are able to bill to medical insurance. So if that's what's the most important for patients, then that's a referral for us, right?
Okay.
Yeah.
Yeah, it's not covered by dental. Myofunction is not covered by dental. You won't have that. So there are codes for expansion is covered by. So interceptive orthopedics, orthodontics is covered by dental insurance.
Tongue tie releases can be covered by both medical and dental. So there are different, depending on the modality and depending on what kind of treatment you're giving.
And I think the big question is someone's probably wondering, can you be profitable with this? And that's part of ASAP's mission too, is to help practitioners take this from an expensive hobby to being profitable, because the bottom line is you cannot help patients if you can't make this profitable. As kind and loving and empathetic of practitioners, if you can't make money at this, you're not going to keep doing it. And we want you to keep doing it and be profitable and your team happy and your business thriving so you can help more people.
I think that's, thanks for saying that, Stacy, because I think that's, that's really what's at the heart of a lot of these questions that came through on this topic, because from an altruistic standpoint, everyone wants to help these people, these patients. But, you're running a business as well. So to be able to marry those two or bridge the gap between those two, there need, what is the Benjamin Franklin quote, doing well by doing good. I mean, you can do both, right? I mean, you can certainly benefit financially while also helping these people. So ASAP does provide some guidance and assistance to help dentists make this profitable. Yes?
Yeah,
absolutely.
Excellent. What about orthodontists and other specialists? We've touched on this kind of throughout, but how the dentists that are on right now, they want to go out and create, sort of allyships with these other specialists, with their colleagues. What would you suggest they do? I mean, what are sort of best practices?
I believe, just looking at this question. Oh, sorry. I just totally interjected myself. Can orthodontists be our allies? Absolutely. And we want them to be. We have orthodontists within ASAP pathway. What the orthodontist is capable of doing can be life-changing for our patients, adults and children alike. I mean, with skeletal MARPE right now, I mean, golly, we're able to expand pretty much anybody, womb to tomb almost. So Yes, the orthodontists can be our allies. Are all our orthodontists? No, just like not all sleep doctors or just not all ENTs and not all general dentists. Like you said earlier, Jason, not everybody is going to want to get on that bandwagon. So you have to have discussions. You're going to have to talk to orthodontists in your community. Are you open to this? Would you take a course with me? Have you done any coursework on this? What are your thoughts on this? Did you learn about this in orthodontic training? Would you be willing to learn with me and be on my team? So I think having those discussions, just like in adult sleep, when we have these discussions with ENTs and with sleep physicians, you're going to have them with your orthodontist in town too. And like I said earlier, there's a demographic of kids at orthodontists right now, for the most part, it's not really on their radar. It is changing. It used to be like, okay, bring them to us by age 7, and then they'll start looking at them at 7. But there's a whole demographic of 3, 4, 5, 6-year-olds that the majority of orthodontists aren't seeing. And you could be helping them within your practice. And then 7, 8, maybe that's when you punt to your local orthodontist and you set them up with this kid that's already had ENT evaluation, maybe some function addressed, like what a beautiful transition to your local orthodontist, treating a demographic that they weren't even wanting to treat anyway. So there's a lot of different ways you can play that.
Got it. That's very useful. Michelle, we're going to fast forward here to the lightning round. Okay. So we've got 4 questions coming up. Michelle, we're going to start with you. Tracy, no. Michelle, we're going to start with you. Which home sleep test do you recommend for kids? 20 seconds or less.
None.
That's fine.
PSG.
Okay. Always a PSG. Yes.
Yes. Right
If
now.
you want to rule out, yeah, that's the only gold standard. That's the only way to rule it out. Are there other ways that we can see something else other than sleep apnea? Yeah. But if you want to rule out sleep apnea, you want to look at the gold standard, PSG is what we have right now.
Boom. You heard it here. Stacy, what food do you absolutely refuse to eat?
American cheese.
Really?
Freaking disgusting.
Okay.
Really?
Oh,
Let's have a little fun with this one. Michelle, what about you?
I eat everything.
I don't know. I eat everything. Maybe chicken feet.
Oh, I eat
Okay.
chicken feet.
Tracy, there's
I
nothing you
don't
won't eat,
discriminate.
Tracy?
I eat it all.
All right.
God.
All right.
Yeah.
They know I'm picky
Tracy,
when we go out.
What about for these kids that we're talking about? Is there an ideal sleep position?
Oh, this is interesting. Because I know that the American Academy of Pediatrics put a guideline now to put babies back on their backs. And then there's a lot of people arguing that babies shouldn't be back on their backs. I don't know if there's a best sleep position. What do you guys say? Because
Well,
I know
it
the guidelines
depends,
is
too.
backs, sides. I know if a
Whatever
baby
they can
sleeps on their
breathe in.
stomach and put their butt up, they're usually trying to open up their airway. So
Well, we
I
know if
sleep
they're
on my back and it's just for my back.
Yes, and it depends. I think it depends on age. We tell adults and children side sleeping. I think if you're talking infants, you're going to have to go with what the pediatrician says. However, we know that if they have enlarged adenoids, actually back sleeping is best for the child with enlarged adenoids because it's on the posterior nasopharynx. So when they're on their backs, the adenoids actually fall back out of the airway. So it just kind of depends.
The latest evidence with the SIDS too. That's why they want kids on their backs, babies on their backs because of
Back to sleep. Yeah.
Yeah. That's what they call it, back to
Back
sleep.
sleep campaign.
That's very interesting. Something I want to underscore that's been sort of a theme throughout the evening is it depends, right? I mean, it's everyone that's on here and wants just a definitive answer for pretty much anything on this topic.
I mean,
it doesn't exist.
Don't go saying that Tracy says everyone should sleep on their back,
Yeah,
I
right,
can
right,
just see
right.
it right now.
It depends.
It
Okay, and
depends.
then this one is going to go. Let's start with you, Stacy, but we've got to keep these answers very brief. So we need 30 seconds or less.
Okay.
What's one life-altering experience, one moment in your pediatric sleep journey that really sticks out to you that keeps you going?
You mean a change in a child?
Sure, whatever.
Or, I mean,
However
shoot,
you
I
want to
would,
interpret it.
okay. I mean, again, for me, it's my own kids. And it really, when we look at most of our ASAPers, they're starting with their own kids. They're starting with their families. And when you can change, and you see the change within your own kid, nobody can stop you, because then you're wanting to help every single kid you can. So for me, it was, I started with my own kids, and then you're on fire. It's like, move, get out of my way. I got to help more kids.
Yeah.
So for me, that was game changing, is helping my kiddos. But I have seen some pretty cool stuff in my practice too. And I've had doctors reach out and go, "Who are you?" This kid would have never, I mean, we've found crazy tumors and all kinds of stuff in kids because of the questions we ask. And anyway, yeah, lots of opportunities to change lives there.
And Stacy, how many kids do you have?
I have three. I have
Do you
three.
love them all equally?
I love them all equally. I mean,
You're a liar. Michelle, will you answer the same question?
I don't love all
What's
my
kind of the
kids.
one moment that really sticks out? Oh yeah, you don't love your kids equally.
I
Yeah.
tell my
No,
daughter
what's-
he's my favorite daughter, and I tell my son he's my favorite son.
Love it. Love it. So
Um,
what's one thing that really sticks out to you and kind of serves as your North Star to keep you going?
Well, my
in
North
this
Star
topic?
is just like Stacey. It's me, because my son didn't sleep for 8 years. 8 years. Interrupted sleep all the time. So when my son's not sleeping, I'm not sleeping too, right? So game-changing experience in pedo is I got to sleep when my son slept.
Sure.
And
Love it.
that's how I know the impact to families and family units and society is going to be huge, is huge.
Yeah. Yeah, sure, sure. If you can help other families get a similar experience, that's amazing. Tracy, what about yourself? How would
Um,
you answer this question?
for me, it was probably when I was able to get my first kid off of CPAP. And I do a lot.
Well,
I'm basically the main person that mostly physicians send the kids on CPAP. So once I was able to do that, I felt like it was proof of concept. It was basically my aha moment with my sleep physicians. Like, you guys need us.
sure.
So I'm surprised that, we've never been invited to the table. So I think for me, that was like, it's not until you are in it with the patients, feeling it with the parents, and you work with these kids and you get them off. So for me, I mean, I've done probably like 30 plus kids now off of CPAP, and that's been really rewarding for me.
Yeah, that's amazing. Kudos. Um, I want to take a quick sec to mention our next webinar. Again, you will receive your CE certificate via email in the next 36 hours. But you can also sign up for our next webinar, which is July 23rd. It's a Tuesday, same time. And it's what most dentists get wrong about sleep. So our panelists will be 3 dentists that treat a whole lot of adult sleep patients, but also do a lot of lecturing. So they get to hear, they get to see a lot of dentists get into this and then get into adult sleep treatment and then abandon it. So they'll kind of they'll answer your questions, but also talk about, what they see the dentists that are most successful, sort of what traits, what habits, what behaviors they see them practice, and then conversely, what most get wrong. So be sure to register for that webinar. It'll be fun. And then also ASAP pathway, we've talked about it, or it's been brought up a few times. There's your contact information there on the screen, or your socials, I should say. Other than visiting the website and checking out your social media, how else can dentists find out more about you?
I have started a podcast for ASAP Pathway. We just have a lot of conversations, and you can hear pretty much, um, I think the authenticity within the podcast sets the tone for what you're getting behind the scenes in our ASAP family too. So people can just check us out, dip their toe in the water, and check out a podcast, have a cup of coffee, and jump in with us.
Yeah, and I don't say this lightly. I don't do a lot of promotion of organizations or companies. But ASAP Pathway is one that, as I mentioned earlier, I've never heard anything but wildly favorable comments about the community and the curriculum that you all provide. So I would recommend that everyone that's on here go and check out ASAP Pathway and determine if it's for you. And if this is something you're going to do, I venture to guess that it is. So check them out at asappathway.com. Check out Stacy's podcast. And then also be sure to come to the symposium where the ASAP Pathway posse will be part of a panel. The ASAP
That posse
posse will
posse
be
panel.
part of a panel.
He's on fire
But then,
tonight.
Gosh.
yeah, I am. It's all about the
Oh.
alliteration. But that's January 31st through February 1st. But I want to encourage every one of you to not just sign up for the symposium, but to come a day early to attend the ASAP Pathway workshop. Again, deep dive on this very topic, limited to a small group, only 35 people. And to make it a little sweeter, because to attend the workshop, you do have to also register for the symposium. But to make that a little more palatable, if you register, let's say before the end of the week, you can use code JT, my initials, Jason Tierney, JT100. That'll knock $100 off. And that way you'll be able to save a little bit of loot so you can easily afford the workshop as well. So tdssymposium.com, use code JT100, sign up for the workshop, help more kids. And, by changing the way that you think and changing what you do, you can make a real impact on people in your community. And by doing that, you're really changing the world. So you have the agency, the ability, the power to change the world by changing yourself, changing your actions, changing your behaviors, and changing your patients' lives. So with that said, thank you to everyone that's hung on. Keep an eye out for your C certificate. Dr. Tracy, Dr. Michelle, Dr. Stacy, thank you so much for your friendship. Thank you for dedicating your time and sharing so openly with everyone here. I appreciate everything you're doing. Appreciate you as my friend.